We will start. I already introduced myself. I'm Nancy Phillips, coordinate the Illinois Family Resource Center. I just wanted to pop this up here real quick. This is the webinar we are doing next month, which is with Nicole Sanders from the Illinois Liquor Control Commission. She always does a great job. And if you're interested in looking at how alcohol's advertised and how it's promoted, especially as it impacts youth and our teenagers, jump on. I just wanted to make sure that you were aware that it's going to be available. And she's done a version of this for the last 3 years, and it's always been really popular. Okay, so I'm going to go back to this and make sure that I tell you the things I need to tell you. The Resource Center, the contract for the Resource Center, which is a statewide program, is handled by the Our House in Charleston, Illinois, which does everything from early intervention to recovery homes through this part of central Illinois. And it's been around 51 years. The Illinois Family Resource Center started 10 years ago. It was supposed to be a 2-year project, and we're now going on our 11th year and just keep growing, which is really exciting because it's the whole looking at families and the impact of substance use disorder on them is a real passion of mine. So that's great. We are funded, let's see, by the Division of Behavioral Health and Recovery. And I keep trying to think, what word can we use? The other was super. And now that we've joined with mental health, I'm trying to think of what it would be. But with the Family Resource Center last year, fiscal year 25, we had the honor of being able to have some funding, very large funding, thank goodness, to address the issues around grief and loss that children have, grief and loss for children that are impacted by being removed from their family. There's grief by living in the chaos, which causes all kinds of feelings of grief and loss and misunderstanding for children, or losing someone due to an overdose. And it's been a big gap, and it's been something that I've worked real hard to have looked at for a long time. Pam was kind of on, has definitely been on board. We've done some similar types of things, and we were offered this funding to develop the materials that ended up being the Circle of Care. And as we've ended this year, we wanted to share, how do you use these wonderful dynamic things that are on the website? And since Pam developed a lot of them, I thought, who better? Because Pam was one of the consultants
Good.
that joined us. And since I've known her since the early 1990s and knew she'd be a good job, I was thrilled that she came on board. And we're just going to keep working together in different projects. I will tell you, the mics, we're in a meeting, so you can actually have some discussion as we get into this. And as Pam shows us some things, I want to make sure that you know, in order to get your CEUs, there will be an evaluation sent out later, and you'll have to fill that out. When we're in meeting mode, that's about the only way we can really track who was here and who needs the CEUs. So please do that. And if you don't get one, email me. I put my email in the chat so early on, so you should be able to get it. So I'm going to turn this over to Pam since we just have limited time. And those of you that have been in webinars with her before, you know that you're going to be in for a good time and a lot of learning. And so I'll let Pam give her history that she may want to share with you. I just know she's a good pal, a good friend, and a very smart lady. So Pam, it's all yours.
Thank you. I will try to live up to that. I Most of the work has been done for this, and I'm going to spend a lot of time just kind of finding out what your use for this stuff might be and showing you how to get around the Circle of Care portion of the Illinois Family Resource Center website. I want to start with a little story. Uh, when my niece, before my niece was born, her parents named her Bigfoot. My sister would look down and there was this huge abdomen, right? And every once in a while, pretty often, she would see this thing that's like a little foot, the outline of a little foot in her skin. And it wasn't that she was kicking her, it was that she was like exploring the parameters of her prison cell, probably. And so they named her Bigfoot. And my sister's husband, my brother-in-law, had a pretty significant problem with alcohol, and he would do whatever other drugs came along too. Um, and he had a really significant problem with rage as well. Uh, I worried for the baby that was on the way. I I wrote a poem at one point that was supposed to be like a little incantation, um, uh, telling little Bigfoot that the house that they lived in um, had a lot of sadness, and there were forces that were making them uh, making it sad and difficult, and asking her through her goodness to heal the family, which is an enormous thing to put on a little baby, but of course she couldn't read, so um, but she may have actually heard that because that's who she turned out to be. She turned out to be very strong, very heart-driven, very soft-hearted, very forgiving, very understanding, and very loyal. Her parents loved her more than life itself, but of course, even loving somebody more than life itself does not make the symptoms of a substance use disorder go away. Once she asked my sister after my brother-in-law had gotten into treatment, all those nights that I didn't even have dinner because you guys were passed out, didn't you love me? And my sister very honestly answered, apparently we didn't love you enough. But they did love her immensely, and she loves them immensely. Um, Her father did get into treatment. He did stop drinking. The rage did not stop, but it got less scary. Um, and when you think about loss and you think about children in families affected by substances, I try to imagine what are the things that she lost during that period. Obviously, childhood, obviously, safety, the ability to have friends over at any time without danger, um, the ability to love herself because he was quite critical. And criticism that is carrying the volume of rage, I think, penetrates deeper. I was raised in a household with rage, not that extreme, but extreme. And yeah, I understood the trauma, but I didn't think at the time of the grief, because who thinks of grief? When her father had stopped drinking for about a year or so, some members of his family started to die, and she was the one who was basically loving, fundamentally loving. And she would travel down to the town where his family lived, and she would stay with them as a little kid, 8 years old or whatever. and brush her grandmother's hair when her grandmother was getting ready to die. She would just be a comfort in any way she could. Uh, and this is what she wanted to do. Who thought of the cost to her? Um, she then lost an aunt, one of her husband's, well, one of her father's sisters, who was larger than life and wonderful and strong, but not strong enough to beat cancer. All of those things, by the time, of course, we hugged her a lot and we told her how wonderful she was. Um, but we did not know, this was before I got into the field. We did not know how much of the iceberg was underwater at that point. And we didn't know the size of it, and we didn't know the shape of it, and we didn't know how to melt it or how to at least keep her safe. By the time she was 9 or so, she had developed irritable bowel syndrome, a bunch of stuff that she had, a lot of physical challenges that she has to this day. Um, she became like the perfect child, the perfect, not perfect, but a heck of a lot more wonderful than most people. And she did not develop a substance use disorder. Uh, and then recently, last couple years, all the anger appeared to her. All the anger happened. And she realized, and she was really mad too. And it was so good because it was so healthy for her to realize, um, and to realize that she did not have to please us. She did not have to be perfect for us. Um, and you know, has dedicated her life to helping children as well. I just wanted to tell you about that because I'm one of the people who should have known about the circle of care. There should have been a circle of care. When circle of care came up, it was a way to deal with one of those problems that we don't get time to deal with. They shoved a very adequate amount of resources at us. They assembled a team of professionals who were experts in various facets of this. And they said, see what you can do. And they gave us the best organizer in the world, our secret weapon, Ambrosia Branson, who now works for Our House as well. So there is, and they had Nancy as our guardian angel, patron saint. um, so this this is a new thing rather than have minimal resources devoted to this on a long-term basis. Just give it a big shot. Like, when you first end up with strep throat, they give you a great big shot in your butt. That's kind of like what this was, only different. So we now have an enormous amount of resources. They are all available. They are available for people in this state. They are available for people on the moon. Anybody can use these. Um, so I would like to ask you about the people you serve, and because these resources are not just for professionals, these resources are for the whole community. Because children's lives are affected by a whole lot of people. Most children who are living in substance-affected families, they're not going to find you. They're not going to find your colleagues. They're not going to get they're not going to be referred for help. It could be people like me and their family who build them up and build them up and build them up, but were too afraid to broach the subject. And there will be neighbors who will see something's going on. I wish I could help that wonderful child or that messy child or whatever child that happens to be, but don't know what to do. And because substance use disorders are so deeply stigmatized, we don't talk about it. And we don't talk about grief either. Even if it's not a stigmatized condition that's connected to it, we're afraid to talk about grief. We may talk with adults about grief. We're afraid to talk about kids. We don't want to make them sad. We don't want to plunge them into some kind of depths. We are afraid of their grief because they are less verbal than we are. And we know that, they're acting like everything's fine. So let's let them do that. Kids are resilient. They'll bounce back. They'll bounce around, actually, is what happens. Um, and so, and so we don't approach it. Teachers don't approach it. Law enforcement comes into the home, you know, takes a parent away or reports a death or breaks up a fight or a one-sided fight. And the kids are just there and nobody knows what to do. So with the Circle of Care, we were given the privilege of finding out, getting the best experts and putting together some things that communities could use. Also included a phenomenal training by a nationally beloved presenter, Jessica Porte. And some amazing research and resource finding by Megan Reagan from the Southern Illinois Resource and Advocacy Center down in the basement of the state. And we created all these resources. So this this presentation is so that we can find out a little about you, the people you serve, the children you're in the neighborhood with, the children, what do you think people need? What drew you to this presentation apart from the CEUs? Why is it that this means something to you? What is it that the title was Feed Your Heart, Feeding Your Heart or something like that. How does this feed your heart? So I'm going to open it up a little bit and then see what anybody has to say. Then we're going to I'm going to show you what's on the website, the tools that you can get, and including a full recording of the training in spots so that you can watch it over several days when you get time. All of these resources, but I'd like to hear from you first. Anybody, just unmute yourself and spill it out.
Hi, my name is Kevin Hopkins, and I work as a family engagement specialist for East St. Louis School District 189. And I signed up for the webinar because I interact with teachers and students and faculty members all day, and the level of interaction varies. But when I see children acting out in school, I wonder sometimes what's behind that. And it's not always the same types of acting out. And there's sometimes instant remorse or refuting the actions, those kinds of things. So with that range, it just makes me wonder what's happening behind the scenes. And I just want to be more effective in what I do when I talk to the children or talk to their parents in my approach.
Absolutely wonderful. There is a component of this project that is bringing to Illinois and really magnifying a program called why am I forgetting
Handle with care.
Handle with Care, which is something that first responders can activate this process. What they do is when they come to a place where there's some stuff happening and there are children present, uh, they they can first of all give the children these comfort bags that were also part of this project that have a fuzzy thing in it and books and little coloring things and everything. And they make a call, and whoever the center is of that Handle with Care program locally, they contact the school. They contact the school of each child in the family, and they say, handle little Liam with care. Liam such and such, handle with care. That's all they say. They don't tell them what happened. They don't spread any gossip. Um, and so there's a whole protocol that the school uses to, and they notify the teachers and whoever the kid in order to understand any symptoms they may see, understand some definite fatigue, and be gentle and understanding with the child. Thank you.
So I'm Deb Bodecker. Oh, let me turn my video on. I'm sorry. I'm Deb Bodecker. I work for a substance use treatment center, and we work with adults 18 and over. But we also we do a lot of DCFS assessments as well, and we work a lot with the DCFS and other communities that work with children to see if we can get the the adults that have the substance use disorder assessed to see if they have the problem and try to get them better to get back with the children along with that. The reason that I like to learn more about this for us and our, not that we work with children, but just to know that we've also worked with the families. And over the years, I think the hardest part is not working with the addicts and the alcoholics themselves, but working with the families and understanding, because it's hard on the families and the children. You know what I'm saying? They don't understand that the alcoholic and the addict is a very sick person, and people who don't have the disease don't understand that. You know, it's not. And I like what you said before about, do they love them? Yes, they love them. You know, it's not. There's a story about a man who goes and buys a toy for his daughter, and he has every intention to go to his daughter's birthday party. And he picked up the toy at the store, and before, on the way to go into his daughter's birthday party, he stopped at a bar for a drink, and he was only going to have the one drink, you know. But unfortunately, because he had that one drink, he never made it to the daughter's birthday party. And you know what I'm saying? And it's not that he did, you know, and this is how alcoholism and drug addiction works, you know. It doesn't have anything to do with how much they love their loved ones. You know, it's the disease. It's like any other disease, like cancer, diabetes, anything. But unfortunately, alcoholism and drug addiction is a disease that tells the person who has it, that they don't have it. So when you have cancer or diabetes, you go and get your medicine. With alcoholism, you don't understand you have the disease, so you don't go get your medicine unless you have some kind of experience where you're ready to go get it, or something happens and you get to the point where you're ready. And unfortunately, a lot of people are never ready. You know, I'm very grateful at some point I was ready. And so we just pray and help it. But the most important thing when we're dealing with the people is to protect the children. The children are always the most important thing. So I'm very, very grateful that I've had the opportunity to help a lot of people be reunited with their children. And sometimes I help a lot of people that don't want to get the help, and the children are protected with foster care or with grandparents or wherever, and so that they can stay protected. And so that's what happens. So anyhow, thanks for everything you guys do with this. That Handle with Care is like the best thing ever. Oh, so wonderful what you guys do. Thank you for the work.
Thank you. Thank you. Who's next? Just unmute yourself. Anybody? Well, let's do it this way. I'm going to show you what's in. Oh, were you about to talk, Teresa?
Yeah. Hi,
Wonderful.
I was really quick. I'm Therese Thurston and I'm with Recovery Community Center in Joliet. And I chose this webinar because we are actually promoting and starting a new program for teens. It's an after-school program called the JAZZ program. It stands for Judgment Free Acceptance Zone. And it's for teens 14 to 18 who are experiencing any type of alcohol or drug addiction with in their environment with themselves or, you know, friends, family. And it's just an after school program to work with the kids and give them resources, teach them how to have fun without using any substance, things like that. So we're working really hard trying to get our students. We just started this program in May, and unfortunately we don't have any kids yet, but we are working hard at trying to get kids to come in, and it's free, you know, and after school. And I thought this would be a really great webinar just to get more resources for when I do have my clients, or we're not calling them clients, just our, I forgot the word we were using for them, but not clients, but just our students to come. So I was a teacher for years and now I'm a CADC. So it will be really a great program once we get kids and get out there.
That is wonderful. I hope you get lots of kids.
Thank you.
And they can tell their friends and everything like
Yes,
that.
we're trying. So I thought this would be a really good resource for me. So I came on to this.
Thank you.
So thank you for, you know, doing this webinar.
Thank you. Who else? Anybody? Okay, I'm gonna open up the website and I'm going to go through it, but I'll show you how to get into the various parts of it and what's in there, but please interrupt me. Please interrupt me anytime you think of something or have a question or have a thought that you want to give the group, anything, okay? Here we go. I'm going to share my screen. I hope you don't see all of my personal information. And you should be able to see anything that I bring up here. Okay, now let's say I don't know the email address of the Circle of Care. Let's see if I'm going to Google Circle of Care. First, I'm going to get an AI description of what a Circle of Care is. I think that's very nice. But if I go down, I get to Illinois Family Resources. And if you don't see that, you can always do Illinois Family Resources Circle of Care, and you'll see that come up. Here is the main page. I'm going to move this little thing up there so that we can see stuff. There's a little video here. This is the story of Simone. There was a story of Liam. I don't know where Liam went, but Simone is up here, and it's a little animated thing.
Simone's life is complicated. She lives with a family member who struggles with drugs and alcohol. It's hard for Simone to understand her feelings of grief as she watches someone she loves struggle with addiction. That's where the Circle of Care comes in, to connect natural helpers with resources like our Grief Support Services Directory and online resource toolkits to support children like Simone. Simone's story isn't over. With the right help, she can find hope and healing.
There you go. So if anybody doesn't know what it is, we've got a toolbar here, shows the different things we have, the year in review, resource toolkit, grief support services directory, the Threads of Hope trainings, comfort bags, Handle with Care initiative as we link to it, and we have a wonderful um, police representative who's worked with us on that. Little description of the Circle of Care. Here are various program components, the resource toolkit, the comfort bags, grief support services directory, and the Threads of Hope training, and the Handle with Care initiative, if you want to get into any of those. If anybody has anything they want to start with, just yell it out. And if not, I'll just go one by one down the side. Is that okay? All right. A year in review. This is kind of interesting because we've got a little video, which is too long to show right now. Just with various, this was the full circle. This was the presentation that we did at the end. The team did this presentation. And there are some other things here, the slides for that video. The Circle of Care Impact Report, Megan Reagan did this. It's a little report of 40 pages that tells the effectiveness of it, what happened, all of the, overviews of the various programs, how many people were engaged, a lot of stuff, the evolution of the outreach in it, key observations. What are the key observations? Multi-pronged approach, cross-sector collaboration, very important throughout this, recommending and facilitating collaboration across centers, across sectors, because let's see, is this the one with has the centers? No. Recommendations based on the outreach patterns. How many people from different things. So this, you can look at it on your own, but that's a nice, I'm gonna move these people over. Okay. That's a nice way to find out how effective it was. Got this thing over here that's keeping me from clicking things. All right, there we go. That's what I'm gonna do. This is something, this supporting children through loss and grief in substance affected families, the story of the Circle Care. We did this after we had finished all our other work. The team that was working on it, on all these things, decided we want to tell our story. We want to do a white paper. So this is a white paper which has many, many different colors on it. It's not just white, it's much more interesting. It has blue and it has green, it has our circle colors. The story of the Circle of Care, it's about, I don't know, 60 pages, something like that. But it goes in depth into what we were trying to do, what we did, with a little introduction to the children in general, to to what we learned in our landscape analysis about the crisis. And this landscape analysis, if you are, I'm going to make these screens a little bigger. If you are in Southern Illinois, you will particularly appreciate the depth at which our researcher Megan showed the plight of downstate communities, how most of the resources are, I think 40% of the resources are up here with me in Chicago, which we have a lot of the people too, but in the southern areas, in the central and southern areas, it is really hard to find resources. And of course, with Medicaid being reduced, there will be there'll be fewer resources. People will have to drive farther, with the closures and everything. But there are um, there are significant needs. There is significant poverty, and she really gave some um, wonderful information to back that up. So this tells about all the different parts of the circle of care. So please do read that report. They have some social flyers that you can use. I'm not a fan of statistics, because I think that it depends on the study, it depends on conditions. You just get those few numbers and you don't know where they came from. However, statistics are what convince the people who make the decisions, so that they can make the right decisions. So they're going to need numbers, and we have some numbers. We also have a flyer with information from the peer listening sessions. We had a lot of listening sessions with not with young vulnerable children, but with people who had been raised in homes affected by substance use disorders or by substances in general, who were still relatively young, but we were very careful to make it safe, and it was safe. And the people who participated in those listening sessions actually found it very healing and very much of a community. So that was satisfying to have something that we were doing in order to gather information, and that they found healing in it. And it makes sense, right? Because it's the lies, it's the hiding, it's the stigma, it's the not able to talk about it, too ashamed to talk about it, that cements a lot of the pain in place. Back to the main to the main screen. Let's look at some of the resources that we created. Here's the resource toolkit. That was the part that I was working on, which is the easiest part, because people like Jessica Porte, the trainer, and Nancy Phillips, our guiding light, people like that knew where the resources were. They knew, and Ambrosia knew about a bunch of stuff too. They knew where the resources were. And I didn't have to know where the resources were. They would tell me, and I would find some on my own as well. And what they wanted in this was something that would not reinvent the wheel, but would give people easy visual ways to get to best resources. Now, this page, we started it with the things that we did at the very end because they were new. This at the left, Circle of Care, an interactive guide of activities and interventions. that was created by Jessica, our trainer. Wonderful, wonderful guide. And this is for clinical people. It is also for community people. It's for anybody. If you are helping a child, supporting a child, or working clinically with a child, you can use these activities. My Circle, My Colors is a coloring book for coloring and healing. It's very imaginative. Jessica is an artist. She's wonderful. And then the story of the Circle of Care, which is what we did at the end, which I showed you. So rather than just say, here's a bunch of resources in alphabetical order, we created a structure for them. Some people are going to want to know about children in a particular age group. So we have the very young children, grade school children, 6 to 12, and teens. There are various resources under here. So if we look, say, at the very young children. We have, I call her Noodle Girl. She's got a noodle sticking out of her mouth or going into her mouth. I don't know. But I love her. And here are some of the things about very young children. We've got each of these photos and descriptions has a separate resource. The supporter's role, in the words of kids who have experienced grief. So all of these three are written, and then age-appropriate activities for little kids, a bunch of age-appropriate activities. And then if we go, let's go to go back to the, well, you can see the grade school has a similar structure. The older the kids are, the more categories we have in there, of course. Then we go to teens, of course, a different collection of resources. Let's look at the intro page. The next, but not everybody is going to be looking for, hello. Not everybody is going to be looking for, get back to the beginning. There we go. Not everybody is going to be looking for resources by age group. So we have other categories here: a deeper dive into loss, grief, and support, expanding the reach of resources, not necessarily the quantity of resources, but getting the resources farther. So things about being inclusive, things about national resource websites, a whole bunch of websites there. We have a lot of resources sprinkled through all of the things that are in Spanish. And here's someplace where all of the resources in Spanish. I love that little girl. The best part of this project was the photographs of little kids. And we have children's books on loss, grief, and healing. So we have 4 categories: books for babies and preschoolers, books that span preschool and grade school kids, middle and high school students. Let's go to the main page again, and then the Grief Support Services Directory is amazing. Of course, Megan did that. It has all the counties, right? You can get it, you can look for resources on grief support for children or for families that are in your county, or you can get, let's anybody want to name your county? Just yell it out.
St. Clair.
St. Clair.
Phil,
Where- St. Clair, here we go. St. Clair. This is what's in St. Clair, Metro East. And in neighboring counties, there's HeartLinks, Community Reach. So it tells, what insurance. Now, what if you didn't want neighboring counties? What if you just wanted your own? What is these are the ones just in your own in Metro East. And that's the only one in St. Clair. End of county results.
Yeah, Pam.
Yeah.
I was going to say, we've been working with Shane, who's our website manager, developer, friend, and can add, if you have a place that that you would like to have put on here, we certainly can do that. You just need to get a hold of Christina or me, and we will follow through. We're not sure how that's going to end up, if it can be just all self-admitted, or if we're going to have to help do that. We may, but we certainly want to keep adding to it.
Magnificent. I am so glad of that. So you'd want to look for your resource that you have in mind first. And if you do not see it, then yeah, definitely send that to Nancy. Gonna fill up your inbox, Nancy.
Or send it to Christina, either one.
Yeah, yeah. Okay, so this is the Grief Support Services Directory, a magnificent thing. The Threads of Hope training, my favorite. I cannot begin to describe Jessica. Is there a picture of her here? Here's a picture
Yeah.
of all the different things, all the different videos of the portions of the days. Jessica, if I were a kid, Jessica would be the person I would trust. And I am an adult, and Jessica is the person I trust. She is gentle, she's kind, she's brilliant, she's creative, she's a kid, she's an adult. She is joyous, and she has the depth of the sadness that kids are going through. She knows it all, and is as far from a know-it-all as you can get. So I totally recommend that you go in here and listen. Now, certainly in the morning, the early mornings in each of the days, you will get a rundown of what is going to happen that day. So you may find out that what you really want to hear first is in the end of the afternoon, so you can go to that one. These are broken down into, I think it's just 5 for each day. So we did give CEUs for the training. There is not at this point a way to get CEUs for watching the
My goal is to get that.
Pardon?
We're gonna find a way to make that work. I'm not sure how yet, but that's our goal.
I know there is a way. I've seen it done. So
Yeah.
yeah, but what you will get is things that will help kids. And many of the people, if you look at let's see, among the threads of sources, uh where does it say? Well, there was something in here that gave people responses to the training. And a lot of people said this was very healing to me. And I think that it was very healing to pretty much everybody who went through it. It was an interactive training, which of course doesn't help you when you're just watching, but it still gives an enormous amount of comfort and care and wisdom. And they had people in the breakout rooms come up with resources that they knew of in their communities, because a family that is experiencing grief due to a substance use disorder is often experiencing a lot of other stuff too, right? So they created from the information that people knew already and brought in with them, they created this wonderful resource list specific to various areas in Illinois. So that's something that's worth its weight in gold by itself. And where? No, that's you. I wish I could find that thing that had people's. I was just looking at it this morning, but
I was thinking it was at the year-end report, but it may be in this section.
it may be in the, yeah, I think it's in the year-end report, yes. You are right. What are the things? Oh, I made, do, 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 do. No. Oh, okay.
We'll share, Pam, if as part of the sustainability, what our goal is, since I mean, there's no specific funding for this at this point, but we want to make sure that it's sustained, and we're working and looking at ways that we can do that. And if you have questions or want someone to to do some work with you around some of the grief and loss stuff or some of the materials, get a hold of us because we can still do technical assistance and some work with that.
Okay. Let's undo that. Okay. I'll go back. Okay. So then we have comfort bags for kids. Are there any comfort bags left, Nancy?
We have a very limited amount. For the most part, I would say we've only got a couple of hundred left that aren't committed to someplace. Our goal is to try and find funding to continue some of this or help people put together their own
Yes.
with some ideas of how to do something similar that's not a huge cost. But they are still out there. If you look at the people that attended the training, and there's a list of attendees back with the Threads of Hope, you can check that out and see if someone in your area has them and if you're interested in seeing if there's any available, because we've handed a lot out. That doesn't mean they're currently being used. So there may be some accessible from the people in your area.
For example, the comfort bag recipients, here
Oh,
are
there you go.
gotten or agencies that have gotten them. So you can bug some of them.
There were 14,400 dispersed. So there's going to be some out there.
And before they were dispersed, they all lived in Nancy's office.
Yes, and Nancy no longer has that office, so yeah.
Okay. And the Handle with Care initiative. We have a wonderful, what is Doug's last name, Nancy?
I don't know. The Handle with Care is also, if you'll notice, the SIU School of Medicine now has some funding to help with that too. So Lisa Wingert is doing a lot of training on the Handle with Care. And so you can get resources from Doug, or you can contact Lisa, get a hold of us, and we can connect you with Lisa. She's actually worked with Handle with Care for a lot of years. Doug has developed it in his county and works with some other counties to do that. So we have two resources we can link you with. And on the web page are a lot of the forms that he developed, agreement forms and that type of thing, that are samples that you can use if you're setting up a Handle with Care in your area.
Yeah, he has a lot of
Yeah, so there's two resources out of the Circle of Care that'll link you with Handle with Care.
while we've got this up, is there anything that we've been through that anybody wants to see again that we should go back to? I'm going to stop sharing my screen and give you a chance to react, give you a chance to ask questions, which I will, of course, pass on to Nancy. No, but which, if you have comments about how it might be used, about how any of it might be used, or what are your ideas, or how we can sustain it, how you can use it in your area, how you can use it in your communities and in your organizations. We would like to, I am a megalomaniac, and I would like to see a Circle of Care everywhere. I would like to see it internationally. I would like to see it in every state, in every country, but certainly throughout Illinois. So how can this be used?
I will say, as you think about that, Christina just put the evaluation form in there that we need for you to get your CEUs. But on that form, we asked for some of the input that Pam's actually asking you to share now. So if you think about it, put it in there, how you've used it or how you see that you may use it, because that's important to us. We want to sustain this, and we need the ammunition to do that. Samika, is there anything you could share from your experience? I just talked with her this week and I know she's used the comfort bags.
Yes, I actually can share. I'm sorry. I was in the process of sending an email out, but yes, I can share. The comfort bags actually have helped a lot. I currently had a financial literacy workshop. I had young adults there as well. They helped out a lot. And then I also was invited to not a networking event, but an event for not for toddlers, but for the age range 8 to 12. And it was a nice event. They was actually cutting hair. They was doing self-care for the kids. It was really nice. The kids was journaling, and me bringing these bags out was fantastic. The bags actually came right in handy. And I had a resource fair, and I brought the bags with me. And the young kids, I had a 6-year-old, a couple of little young toddlers and young, I wouldn't say young adults, but young kids come in. I kid you not, they kept getting their cousins, their friends, their people that was around them, and I just saw how excited they was with the bag. And then I had one young lady, she sat at the table. She wasn't no more than 7 years old, and she was digging through the bags, and she was so excited. And then one thing that really caught my attention with her, which caught my attention when I went through the bags, was the small wooden hearts that you guys put in there. Oh my gosh, she kept playing with it, writing on it and stuff. And I couldn't believe it, but I could believe it because it caught my attention too as well. I had those same hearts for my daughter for her first birthday. She had passed, she was stillbirth. So I had people writing those hearts and then put it inside like a butterfly portrait, and they just wrote their initials or wrote something small. So when I saw it in the bag, and then I saw the young lady, the baby, well, she's a baby to me. When I saw the baby playing with it, I just was like, oh, it caught her attention just like it caught mine. But yeah, the bags really helped a lot. And I had 50 bags donated to my organization, and they all gone. They all gone. All my bags is gone.
Yeah. We are at time to quit, but I want to know anyone that wants to stay on. We've got a few minutes. I've got a 1:30, but anybody who wants to stay on and chat about this is welcome to. Has anybody else used them that wants to share? We're trying to collect that information.
We really appreciate everybody being here and taking all this in. And we hope passing it on, doing something with it. And we thank you for what you are doing for kids, for adults. This is so important, and you're putting it all out there, and you're giving of yourself every day. And we cannot thank you enough.
Yeah, and I appreciate it. It's important to all of us. So I'm going to end this. If there's no more comments, I want to thank Pam because she has put her whole heart for a year into this project, and we've been very blessed for that. Her and Megan and Ambrosia and Jessica. And I've kind of been following them around, but I had other things to do. So Christina and I've kind of followed them around. And Barb, thank you. I know you were in the training. So
Nancy, somebody in the
yes.
chat said they wanted to stay on in
Okay.
chat for a little bit.
I missed that.
So
I apologize. Okay. Who wanted to chat? Because we're here. Whoever
Well,
wants to stay for another, I would
Yeah.
say 10 to 15 is about it because everybody's got other meetings. But I think if you want information, it's important to do that.
whoever doesn't go away is the ones who want to stay.
Exactly.
Hello, everyone. I'm Katrina Ivory, and I'm a parenting coach working for Maryville Academy Moms Recovery Home Network. Um, I'm I have to apologize. I joined late and didn't realize. I think the time zone was mixed up in my in my email. I didn't change the time zone, so I'm just joining. But I'd just like to get some basic information about the Circle of Care tools.
I'm I'm Consuela Jones as well. I had multiple people I had forward this training to, and so my name is appearing multiple times, so I can't get on camera. I don't know why, but it's okay. I hope that you ladies can still hear me, but
Oh,
I'm
we
just like
can.
okay, I'm just like Miss Ivory. I came on a little late because I was on a call. But I'm so interested in learning more about you all's initiative and how we can incorporate that here at Chestnut Health Systems. We're located in the southern region of Illinois.
Oh, yeah.
Yeah,
Definitely.
I've done a lot of work with Chestnut down in Southern Illinois, still am. I do want to share that this will be because we are recording it, and if Zoom cooperated, it will be posted by the end of the week on the website under the list of videos, because we video these and post them.
If Zoom cooperated. If Zoom does not cooperate, Nancy, can everybody see your email address? I saw somebody on the,
I put it on there a couple of times, but we can always do it again.
but yes, you are in there. How long will the chat live? Is the chat?
That I don't know. Sometimes they send me a copy of the chat. Sometimes I don't get one.
So she's Nancy P. at ourhouserecovery.org.
Right.
RHOUSE recovery.org. And if it doesn't live through it and she can give you to me or give me your information and I can take you through it like on a Zoom call.
Yeah.
Sounds great.
Can we
Yeah.
put our email address in the chat? Would you all be able to get it?
Well, we don't know if the chat is going to go away as soon as Nancy closes the meeting.
Got it. Okay.
And like I said, sometimes they'll send a copy of the chat, but this is in a meeting setting, so I'm not sure what to expect because we usually do webinars, but we wanted you to have the freedom to jump in if you needed to. The other thing that you could do is you could go to the website and there's an info email address that comes through my email too, so you can always do that.
Okay. Thank you, ladies. Thank you.
And we should have, if you registered for this, we should have your email address.
Yeah, I know I registered, but like I said, I forwarded to some community friends and I wanted them to participate and attend as well. So that's why if you all look back, you'll see my name on there like 7 times. I think
Oh
seven.
my
or-
gosh.
I don't know. But I wanted them to come as well. So I'll forward your emails to them as well so that they'll have it and hopefully they'll be able to register register so that they can attend.
Yeah, well, if you want, if they want CEUs, they need to fill out that evaluation are you gonna send that out, Christina, or how are we doing that?
Well, I posted it in the chat,
Yeah,
but
that's
we
right.
can email it.
Well,
I'm not
except
sure
I don't know either because
because
it doesn't give us an attendance list when you do it.
yeah. Well, if you want to, I'm sorry, I think I'm gonna butcher your name,
It's
Consuela.
Consuela. It's Consuela. Yep, you're fine, Christina.
I am going to put it again in the chat if you want to copy it, and then so you can send it to your to whoever you forwarded the invite to, so that they can fill out the the survey if they didn't get a chance to fill it out, so that they can have it, and then that way we'll have the email address as well of the people who attended.
Yeah.
Okay, we'll do that, Christina. Thank you. So I have a question. The bags, and I know you all probably had covered this in the presentation, but how does one get those?
We don't have very many left.
Ah, got it. Okay.
If you look
Um,
at the website, though, if you look on the Circle of Care website, which is part of the Illinois Family Resource Center website, you will see in the right-hand side in that menu, you'll see something that says comfort bags. You can go to that page, and there is a place where you can see a list of all the agencies that have received comfort bags. So there may be some in your area. Some will have given all their bags away, but some will not.
yeah,
Some-
and I don't want them sitting in somebody's closet not being used, so I would
I
check
know
in.
that's right, Nancy. I'm gonna check everywhere. I know that is correct.
The other thing that you can do is you could get a hold of one of us or look at what you see with the bags and start developing your own. They don't have to be exactly what we've done, but it's something with that concept. I've used that concept and a lot of the materials that ended up in that bag for a number of years in counseling and doing counseling and therapy, even with adults. So
Everybody was so appreciative of the little wooden hearts, but the little wooden hearts were Nancy's. That's Nancy's trademark. That's what she has little wooden hearts instead of bones, I think.
yeah, I've used those for years in training and stuff, and they're good tools. Or circle discs are good too. And they are not expensive. They're very inexpensive to buy off of Amazon.
And then you just bring a bunch of markers in
Yeah,
different.
markers, crayons. My 8-year-old granddaughter uses crayons on them. She's had some trauma in her life, and I've used those with her a lot, and they're very healing. So there's lots that you can not replace, but lots that you can take that to trigger ideas of your own of things, the Mimble balls, which you will see with the strange hair and all the colors, they're very cute. But if you go to a Dollar Tree or one of the places that you can buy stuff in bulk, you can buy stuffies that are similar and kids can hold on to. They can stick it in their pillowcase and know that they've always got somebody safe with them. It just takes a little creativity when the other supplies are gone and still reach some dynamite work and help for our kids and our teenagers. They love to journal. You can get journals pretty inexpensive if you go to the right place. If you go to the right exhibits, you can pick up memo pads and stuff at no cost if you're
And
at a conference.
the journals, the kids have to know, keep it in a safe place. Keep it,
Yes, definitely.
don't put anything in there that could get you in horrible trouble. Like the truth. Horrible trouble.
So, but we'll be glad to help you in any way we can.
Oh, yeah.
We
Any-
just ran out of money.
There's just so much you can, yeah, there's just so much you can do. Anybody else, any thoughts?
Well, I just want to say thank you for all the information. When I did come in and I saw just how everybody was participating and or providing feedback regarding the bags and how really I think just anyone who is, going through things and, is at home and, don't have a lot of resources or, and that could be financially, that can be, just, some people don't have a computer, some people don't have certain things that they can get online and insurance is an issue, just a multitude of things, but just to know that people can actually take something, apply it, use it at home and replenish just common things that are in their home, common,
Right.
step outside, just things that are outside. So that's very useful. So thank you for that. I appreciate that.
Well, I can give you an example of something before we sign off. It's really crazy. If you're familiar with what a buckeye is that comes off a tree, it's brown and then it has the eye on it, and they're very smooth. I used that a lot of times when I was overseeing outpatient services, and I would be working with clients that would get stressed and or their children. I'd hand them Buckeyes and tell them to put it in their pocket. And anytime you feel that stress, take it out and rub it in your hand. And it's amazing how those little things that you can pick up, a rock that has that same feeling, it works. It just takes that creativity. And a lot of times you learn it by accident, oh, that worked. So you don't have to have the bags to do dynamite work, because I believe anyone that's in this field has a pretty good brain to stretch it, because we've learned to do that.
And the bags are part of the circle of care. There's just one thing that we did. If you
Yes.
got here late, don't forget that we have a whole website full of resources, including a 2-day training by a marvelous trainer named Jessica Porte, including a toolkit that gets you to a whole bunch of things, that a resource directory county by county for the whole state. So there's a lot of stuff in there that you can find that will that could be very helpful in a lot of ways.
I think the way to do it is you just sit down sometime when you've got an hour, and you can just start digging through it and take it layer by layer and say, oh, well, I like this. Oh, I want to come back to this.
Yeah.
So. Anything else? This has been great.
I have enjoyed it.
Can I ask Katrina, where is she from?
Sure, I'm located in Chicago. We
Okay.
have multiple sites. We have a site in Berwyn, a couple of sites in the Chicago area, Austin and the Austin area, as well as the Westtown area. So we're kind of a new initiative, trying to keep the parents working with the intact family. I mean, people who have intact cases with DCFS,
Mhm.
trying to keep the parents and the children together. And as you all can imagine, everybody has experienced a lot of bad things.
Yeah.
Oh, yeah.
So as many resources as we can get together for the moms and the children, that's what we do. So we're constantly trying to learn new initiatives and provide our clients with different things that's going to be, help them with success outside of the Recovery Home Network. So for us, that's important.
Yeah.
For them, that's critically important.
Yes.
Yes. And Consuela, where are you from?
Thank you, Katrina.
You're welcome.
I'm from the Southern Illinois area. We're located St. Clair County area by
Okay.
like by East St. Louis, Belleville, Fairview
Mhm.
Heights,
Okay.
Granite City. Yeah, we're in that area. And so we have started this new initiative. It's called ROS, Recovery System, or Recovery Oriented System of
Systems
Care.
of care. Yeah.
And so Merck, which was in Madison County, that's still in Madison County, they had bridged Madison and St. Clair County, and now we have separated both counties. And so I just came on to be their community health specialist that's kind of managing myself and Angela Holloway. I'm so sorry. Angela Holloway and myself are overseeing this area and just making sure that we can, I'm gonna be honest with you, everyone, and Katrina and everybody, just trying to make sure that everyone have available resources and have access to those resources. When I
Yes.
was the person that put that question in about the community resource guide, because we're trying to generate one right now. There's so many resources in Illinois, so many, that provides supportive resources for mental health, substance abuse, overall health and wellness, everything, parenting, just a multitude of things, but we're really trying to work very hard and trying to do more of a comprehensive, detailed resource, but something that people can just look at and say, you know what, if we need a parenting resource, but they can just type something in, or if we can do like a one pager, something
Right.
like that. We're trying to,
Okay.
yeah, we're trying to figure some stuff out, but it's just so many, so many resources that we have. And we just want to make it easier for people, because when you start giving people, like a booklet, almost 20, 30, 40 pages, nobody's going to read that, first of all. I wish we had like a centralized location where people can just type their zip code in and bam, if you need a crisis line, here it is, 5 miles or 2 miles away from your house. So hopefully Angela and I are both working very, very hard with community agencies down here to do that. But we're kind of liaisons. We're just trying to link people, community partner, friends, we call them, and the community with resources. That's basically what our position here for the ROSC is.
Okay.
Yeah.
Thank
I'm
you,
very familiar
Consuela.
with Ross.
My email is in the chat box, so if you want to
Oh,
reach out, please do. I
I
can make
will.
sure that you have pamphlets and what we do.
Okay.
I also do community parenting. Actually, I'm teaching sessions of Chicago Parenting Program by USC now. So just
Okay.
reach out to me and we can connect.
I will. Katrina, thank you so much. Thank you. Because
You're welcome.
we have these programs as far as Chicago, as well as coming all the way down south, like near Carbondale. So that would be fantastic. So thank you so
And
much.
we actually engage parents or individuals from all over the state of Illinois. So it's not limited to Cook County or the Chicago area.
Oh,
We have parents
wow.
from everywhere. So just
Oh, yeah, I will definitely
send
be
me an
sending you
email.
an email, Miss. I definitely will, Katrina. Thank you. I definitely will.
You're welcome. You're welcome.
Okay.
Okay, ladies, I hate to say it, but I'm gonna have to get off.
Thank you all so very much for
Everybody's got these
everything.
crazy schedules, I know. And I loved hearing you talk. And Consuela, I would love to sit down and talk with you a little bit more about what you're doing too, as
Definitely.
you build that resource.
Yes.
Yeah, that would be great. So all of you, be safe, have a good week, and thank you so much for your interest.
Thank you all.